The following segment is sponsored by eHealth. With the deadline looming, it's easy to make hasty decisions about healthcare, but that can all be avoided with careful planning. Medicare expert Fran is here to share tips on navigating selection and enrollment coverage. Fran, welcome to the show.
Laura, it's my pleasure to be with you today.
We are so excited to talk to you about this because it is so important. Okay, the deadline to enroll in a new Medicare plan is December 7th, right around the corner. Why is it important to not wait until then to select and enroll in Medicare coverage?
Well, Laura, I think it's sort of, unfortunately, it's commonplace that we see a lot of procrastination. I, too, am a senior, and I have been known to procrastinate, so I can relate to what people are going through. But I would strongly urge people to stop the procrastination now. It really does affect the experience when you wait until the very last minute. You're going to have long waits, and no one wants to wait on the phone and listen to really bad music for an extended period of time. So you don't need to do that. You can de-stress your life and take action today. Go online at ehealth.com or call our toll-free number, and we're ready to answer your questions and help you find the right health plan for 2024.
There you go. Forget about that awful phone music. What does a beneficiary need to know if they decide to enroll online for Medicare coverage themselves?
Sure. Online is becoming such a wonderful experience now. I mean, the retail world, people are used to navigating websites and shopping and buying online. And we've approached the health insurance side in a very similar manner. We are all about creating a beautiful experience, shopping, comparing, and then enrolling. We also have what I like to call a lifeline. Right? Just in case you get stuck along the way, you have a question along the way, you hit that help button and a live agent will join you in the chat room and either respond to that question. You can go on the rest of the way yourself, or if you would rather they stay on and help you get through the entire experience, they'll do that too.
Perfect. Let's talk a little bit more about that. What can a beneficiary expect when they speak with a licensed insurance agent?
Well, when they contact eHealth, they're going to get a licensed agent who's really good at listening, because it's important that they ask the right questions and then go into listening mode to make sure that based on what you say is important to you, could be your prescription medications that you want on the, you have to have a plan that has those prescriptions on their formulary with the right tiers, or there may be some other things that are important to you, for example, supplemental benefits. So everyone is different. Health insurance is very personal. So your experience and what your needs are going to differ than your neighbors or family members. So it's important that you have a relationship with an agent that you can trust, who is listening to you carefully and can then help determine which plan options are best fit for you for 2024.
Absolutely. Fran, this has been so helpful. Where can we go for more information?
Sure. Two options. One, call our toll-free number, 866-552-0796, 866-552-0796, or go online, ehealth.com, ehealth.com.
Perfect. Thank you so much, Fran. We've enjoyed talking to you.
Laura, it's been my pleasure. Have a great day.
You too.